We're back with today's health and putting an end to chronic neck and back pain. Dr. Norman Marcus, a pain specialist, runs the Norman Marcus Pain Institute. And with him is Karen Edwards, a patient of his who suffered from back problems for many years. Welcome to both of you. Dr. Marcus, you actually have a more of a non-surgical approach. Everything about you is working with the muscles because you say muscles are mostly associated with back pain, right?
That's true.
And what are some of the muscles, what are the areas that you're seeing are the problem areas for most people?
Well, low back pain is one of the biggest problems for patients in the United States. And actually, it costs $86 billion a year for low back pain and neck pain.
Mm-hmm.
And many
Americans are being treated for that.
Many Americans are getting treatment for back and neck pain. And the cost is huge. Mm-hmm. And the thought is generally not muscles. Because as physicians, we're not taught about muscles causing pain. We're always taught that the nerves or a herniated disc or the spine is causing the pain. And therefore, we end up with surgery sometimes that are inappropriate. Sometimes you need it, but most of the time you don't. Actually, 85% of cases of back pain are diagnosed as non-specific or idiopathic back pain. And most of those cases are for muscles.
All right, and so there are 4 causes of muscle pain. What are they?
There's tension. If you're under stress, that can cause
We all
pain.
have felt that.
We all feel that, particularly in our shoulders and sometimes in your back. There's muscle deficiency from being deconditioned, not exercising enough, and being stiff or weak in those muscles. There's spasm when your muscle tightens up on you and you can't move. And then there's what we call trigger points. And trigger points are these little knots in the muscle that need to be deactivated. And we have a technique where we can do that.
All right, we'll get into the technique in a minute. And what about for chronic pain sufferers? Is that related to muscle pain usually?
Much of chronic pain is muscular, but we don't think about it. So therefore, the patient is relegated into this area saying, you're a chronic pain patient and you've got to be on drugs for the rest of your life. And in many of these situations, it's not true. In Karen's situation, for example, she had pain for 20 years.
Yeah, Karen, I mean, tell us how severe your back pain was to the point where you weren't able to do a lot of things with your children, you weren't able to lift them up. I mean, how bad had it gotten?
At its worst, I would experience severe muscle spasm that would literally bring me down to my knees on the floor, where I would have to crawl around on my hands and knees on the floor. And I was unable to take care of myself and my family. My sister would have to take care of my kids for me. I would eat my meals off the floor because it was
like a dog. I read that you were standing over your meal like a dog.
Yes,
exactly.
It was incredibly painful to sit or stand, and it was just excruciating. I explained to my family and friends that it felt like a knife in my lower back and then like a vice on top of that, tightening that knife in my back.
And what was your doctor at the time, before you met with Dr. Marcus, telling you about what you needed to do in order to be cured?
Well, at first I had a series of cortisone injections, and then after my 3rd injection, he was telling me that if I wanted to fix the problem, meaning surgery, then that would be my next step, and I did not want to have surgery. And when I approached him with the information that I had since read about Dr. Marcus, he unfortunately became very defensive and a little condescending and told me he sees 100 patients a day and that it sounded like I needed to find myself a new doctor. And luckily, thank God, I did. I found Dr. Marcus.
And the approach that you're using, Dr. Marcus, with Karen, tell us about it, and would it work for a lot of cases of people with back injury?
It would work for many cases. In fact, we're doing a study right now in San Diego where we're taking patients already scheduled for surgery, and the majority of them were able to avoid the surgery.
So what were some of her problem areas as we look at this musculature system chart behind us?
Well,
and
Karen
what was the course of treatment?
She actually had pain in her neck and in her low back. So the pain that she was experiencing in her neck actually was coming from this muscle. And in most of our patients, that's the case. And the pain in her back was coming from this muscle here.
And it was causing the spasms and all
And it
of
was,
that she
yes,
feeling.
and the muscle off on the side.
And you have an instrument that you're holding there that helps detect, actually pinpoint the exact areas where the pain is?
I developed this with the Stevens Institute of Technology, which is an engineering school in Hoboken. And we are able to...
I live there.
You do? Okay. So we are able to identify which muscle causes the pain with this device. and it's unique, it's revolutionary. We're actually going to do a study in Spain.
Interesting.
Starting this summer.
And Karen, you have had no problems. You're doing a lot of exercise too, right? Part of the program is doing exercise,
yes.
and some injections are involved?
A big part of the program is exercise. So if you have trigger points, you have to inject that. But if you
what
have
are you injecting them with? It's not cortisone.
We never use cortisone. We never use steroids. We're only using lidocaine for comfort. It's the needle breaking up the muscle.
But you're going into the muscle rather than into the areas,
We're
the
going
back
into the
areas.
muscle where the muscle begins and ends, along the course of the muscle.
And that and the exercise that you're doing, you've been able to, I know we have pictures really quickly of you able to do all the things, lifting up your kids and
yes, I'm able to resume my active lifestyle that I've had prior to my back pain, and I can pick up my kids when they cry.
And
I
bend
can
over and touch your toes.
Exactly, and I do the exercises on a regular basis, and I've been pain-free for, in June it'll be a full year.
Well, we're glad to hear that. Karen Edwards and Dr. Norman Marcus, again, thanks so much. Best of luck to you.